You are listening to Midday. I'm Maria Shilaos. A warning today about the use of GLP-1 medications, the prescription drugs that help people lose weight. Many insurances don't cover these medicines and is pushing patients to use unsafe knockoffs. I spoke with Dr. Angela Fitch, past president of the Obesity Medicine Association, to learn more.
Well, in particular, the compounded GLP-1 medications are the issue that we see most commonly right now. Medications such as GLP-1s have been pivotal in terms of helping patients to lose weight and maintain weight reduction, as well as make significant health gains as it relates to heart disease and sleep apnea, diabetes, other chronic diseases as well. But the compounded versions are just not the same as the original FDA approved branded versions. And that's what consumers need to know is you need to understand that they're not the same and what those risks are going to be when you're seeking treatment.
Okay, so why are they, first of all, turning to these knockoffs?
Well, because insurance doesn't cover obesity like it does other chronic diseases for decades, it has been stigmatized and it's been thought that, patients should be able to just lose weight on their own, right? Everybody's been told multiple times to just if they ate better, if they exercised, they would not have this disease. When we know that that's not the case at all, meaning we know scientifically now that obesity is a complex chronic condition, much like other chronic diseases, and deserves treatment with not only lifestyle intervention, but also medications and surgery and procedures. All of that has to come together to optimize any chronic disease treatment. And that's what we're experiencing is because we don't have good coverage for these treatments, it makes it harder for patients to access, and then they go and get, a risky knockoff version.
So why are they risky? What's dangerous about them? What are the effects?
The compounded versions are just not approved by the FDA. So you could be getting no medication in that vial. You could be getting twice as much medication in that vial. There isn't as much regulation around them as there are the original branded FDA versions. And so again, because of that, they're also oftentimes adding other things to the medication, such as vitamin B12, and they're doing this in order to get around some of the legal implications around compounding. And when we do that, we don't know what happens when those two things sit together, in a vial. It might make the medication less effective. It might make it have properties that would lead to risk of human health and well-being. So it's not something that we consider that patients should be, accepting that level of risk for any type of potential benefit of that treatment.
So are there other alternatives? What is your advice for those patients?
I think our advice is to really talk to your doctor, right? Talk to a clinician who you respect, who's going to be taking care of you for the long term, because this is a long-term chronic condition. This is not something we should treat episodically. It's not something we should treat lightly. And you should talk to your doctor about treatment options because the cost of these medications is coming down. Each of the pharmaceutical companies has direct-to-consumer websites where the cost is cheaper than if you were to buy them on the sort of, at the local pharmacy. And so again, seeking out, other medication options that may be more affordable, other treatment options that may be more affordable, or, other ways to get access to FDA approved medications is what we're recommending, especially today.
Doctor, what is your recommendation for policymakers?
I think, we've already seen some incredible policy happening last week. We've been advocating for 13 years now, going to Capitol Hill. I myself have been there year over year, trying to advocate for Medicare to get access to obesity treatment. Because Medicare didn't have coverage for obesity, then that led to the disease state itself being carved out of insurance plans. And so because it's carved out and isn't effectively treated, this is what we're the issues we're talking about right now. And now I think, that Medicare, as of next year, Medicare has the opportunity to cover these medications for certain Medicare beneficiaries. That will be game changing in terms of hopefully advancing access for all of the millions, hundreds of millions of Americans that need access to care.
All right. Any final thoughts for us?
I think if people want more information, we encourage them to go to the Obesity Action Coalition. That is our patient advocacy arm for people living with obesity. And they have a lot of information on their website, www.obesityaction.org. And you can find information about what we talked about here today, as well as where you can find a clinician or a physician that will help you with your obesity treatment.
All right. Thanks so much for your time today.
Thank you, Maria.